I did want to acknowledge HRSA and NICHQ for advancing a tremendous framework for a collaborative approach that really helped our community organize our obesity prevention efforts. I wanted to take a minute to, if you could go to the next slide, please, touch upon some of the characteristics of the collaborative that I feel really helped our team achieve focus and move forward. And we know that, with this work, achieving focus can be difficult, and so this is really helpful. First, the Healthy Weight Collaborative approach provided the strategic framework that we needed. We didn't need to build it ourselves. Goals and strategies and expectations were outlined from the beginning, and we had to sort of buy into that. It might seem prescriptive, but the framework really helped our team focus and implement strategies in a way that aligned with the assets in our community. So there was flexibility within that framework. We had to next define a small multi-sector team. I think we had 4 sectors: public health, primary care, community, and consumer sectors. And we were told we couldn't have more than 11 or 12 people on our core team. As a team lead, I had to be really thoughtful about who to involve. Would they be active participants, committed to the goals? Would their spheres of influence align with what we needed? Did they have the authority and ability to impact change in their respective sectors? All of those were considerations as I pulled together the team. As a team lead, it was easier to define the roles for each team member, and the smaller team was easier to coordinate. And I have learned that you can have a small, focused team while still maintaining broad community partnerships. Next, the focus on quality improvement was so important. We didn't have to come up with the perfect plan before testing small changes. This meant that our team was doing things all along, even if what we were doing needed to be adjusted down the road. Still, we felt like we were making progress and learning all the time. The Learning Collaborative approach meant that our team had access to the Healthy Weight Collaborative faculty as well as other teams. We just felt like we were connected to something bigger, and that was really important for us. We learned a lot together during the learning sessions and the webinars that we participated in, but we were also put in a position of teaching from time to time, and that helped build capacity for our team. Next, we had to define a clear target population at the outset, a population that we would be able to measure on a monthly basis. We had to think smaller than we would have had we been left to our own devices. But having the defined population allowed us to get the data we needed because, finally, the measurements that were expected of us were clarified from the outset, and we needed to develop a habit of getting data on a regular basis. We were collecting or providing data on message reach, process steps, policy change, and even the nature of our collaborative. Just as there was a strategic framework, there was a corresponding measurement framework. And collecting the data regularly helped our team see progress, which was encouraging, but we were also able to share that data with key stakeholders later so that they could better understand our goals and the progress we'd made. So the measurement really helped to set us up to be sustainable. Next slide, please. And this is just an example of the strategy map that we put together to help us organize our thinking and figure out which strategies needed to be implemented or could be implemented in each of the sectors that we were working in. Next slide. As Shayla mentioned, we were required to select a core message to use throughout to support our efforts. And like San Diego, we also selected the 5210 message. This common message linked the work in all of the sectors and helped create more of a community movement. And I'll describe how that transpired in a bit, but the message has really been vital for giving our efforts a stickiness factor and has been a great tool for engaging partners. Next slide, please. So I wanted to touch a little bit on the work that has been done in each sector. In the primary care sector, we've been working with a pediatric clinic managed by our local health department. And here we've implemented some new processes and workflows to support improved assessment and follow-up in addressing healthy weight. One of the biggest changes that we made was to develop and implement a healthy weight plan. This is a standardized tool which helps our physicians navigate that somewhat difficult conversation about weight and also facilitates goal setting among patients and families. This plan aligns with the 5210 message, and it was recently included in our new EHR. We've done some early evaluation on the plan utilization and effectiveness, and we found that among patients who had completed the plan, there have been some significant improvements in BMI, which is very encouraging. We've also had great feedback from the physicians and staff regarding the plan. They were engaged in the process of developing and testing this tool, and they're now very receptive to actually using it, which of course is important. In our primary care site, we've also implemented obesity-focused group visits, and these provide an opportunity for physicians to provide additional guidance, but also for patients and their families to discuss challenges and successes. As a policy target, we're looking to embed the use of the Healthy Weight Plan into all of our clinical sites under our health department and expand the group visits as well. And we're hoping we can have some influence on other primary care practices in our broader community as well.